Hey everyone, we're just waiting for a few more to join and then we will get started. It's so good to see you all. So good to see everyone. And as if you have attended our sessions before, you're well aware that people join throughout the session, and certainly the sessions are available after today via our website. So good day and a warm welcome to each and every one of you. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series. This is a platform dedicated to exploring the diverse landscape of advanced nursing care around the world. My name is April Kapu, and I'm the Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt University School of Nursing. I would like to thank my colleagues, Betsy Usher and Megan Allen, and all of those who helped us put together this global collaborative series. The purpose of this series goes beyond borders. It's a journey to learn, to understand, and to foster connections that may lead to meaningful connections in the realms of advanced nursing practice, education, and regulatory frameworks. This series serves as an open invitation to communicate, share experiences, and collectively contribute to the enhancement of advanced nursing care on a global scale. So we are delighted to have you all here, and I am just very, very excited to have such a dear friend and colleague here joining us today. So please let me introduce our speaker, and I would also ask that you all mute your microphones throughout her presentation, and then at the end, we will open up the dialogue for questions, for comments, as we learn more about advanced practice education, regulation, and education in Brazil. So now, without further ado, please let me introduce our global expert in advanced practice, Dr. Jane Marie Staccherini. She is professor and associate dean for global affairs and director of the WHO Collaborating Center for the University of Michigan School of Nursing. Dr. Staccherini recently joined the University of Michigan team, and she is leading the way in global health on many fronts. She is passionately dedicated to using unique educational research and global leadership skills to spearhead culture transformation. She has been actively involved in various interdisciplinary health mentorship programs, which allow underrepresented students to explore health careers, including nursing, with over 1 million of internal and external grant funding to do all of this. Just absolutely amazing. Globally, Dr. Staccherini has continually collaborated with Latino American nurses and other health professionals to raise the profile of nursing internationally, improve global health, and tackle challenges related to social justice. She is recognized health disparities. She's a health disparities researcher for promoting community engagement and mental well-being in underserved rural communities with Latino immigrants, LGBTQIA plus adolescents, and HIV in international vulnerable and diverse populations. Her DEI work, global affairs work, her advocacy, and research success have been translated into several awards, including selection and induction as a fellow in the American Academy of Nursing. It is my absolute pleasure to have my friend and colleague, Jane Marie, join us today. Jane?
Thank you so much. Wonderful introduction. Thank you so much. It's a pleasure to be here and to talk a little bit about the work that I have been doing for several years. And I just recently joined the University of Michigan, the School of Nursing, where I'm going to keep doing this work and expanding to other countries in Latin America. So it's my privilege and honor to be here with you all. So before I jump into our conversation, I just would like to add a few more things about myself. I am originally from Brazil, and I received my BSN, my MSN, and my PhD all in Brazil. I'm not a DNP prepared. When I graduate with my bachelor degree in nurse, I decided to take an internship in the middle of Amazonia in Brazil. My office was in a boat. This is a simulation what my office was. And I worked with very diverse native indigenous tribes and communities, approximately 300 different tribes who likely spoke more than 200 different languages. My work was public health, but a very focused on underserved community. Also, that was my first experience advocating for social justice for global minoritized people. That remarkable experience really helped me to understand that knowledge comes in very diverse ways. So then I immigrate to the US about 24 years ago, and internationally, I have established collaborative partnerships with university, particularly in Latin America, but also in other parts of the globe, including Thailand, Mexico, Portugal, multiple universities and agencies in Brazil to support teaching, research, service exchanges for faculty, for students. And I also have developed and direct study abroads in Mexico, support colleagues initiative in Ghana. In addition, I have been co-chairs and chair of master PhD students in other countries, and also contributing with research in several parts of the world. So I'm passionate about global health. Regarding my presentation, why advancing APRN in Brazil? This is a global movement, and we all know the importance of advanced nurses in supporting global populations. So just a little bit about Brazil. Brazil is a very large country, is not considered not very low income, but it's a middle, considered like a middle income country, but we do have a lot of poverty. So the country has 26 states, one federal district, more than 200 million population, 90% live in urban areas. Although we talk a lot about rural areas in Brazil, but 90% are located in urban, but we do have a large population in favelas or slums. We do have more than 2 million nurses, but one challenge is that more than a half of them are nurses, associate nurses that would require more education. So Brazil has some major health problems, chronic health conditions like many other global countries, and we've been battling this for a while. In terms of infectious disease, HIV, tuberculosis, dengue, we still have malaria, so a lot of infectious disease. Cardiovascular, stroke also are top cause of death in Brazil. Diabetes, it's a large number of the population, including children. Depression is also another huge problem, also cancer. One great advantage in Brazil is the healthcare system. which is a unified health system. So primary care, outpatient specialty care, mental health, hospital care, and a lot of prescription drugs are covered by this system with no cost, zero cost to the population. Does the system works greatly? No, we do have a lot of challenges, but at least the population do have some support from the government. Focusing on advancing the APRN in Brazil, how that start? We start in 2019 when some colleagues from Brazil were invited to attend a conference at the University of Florida College of Nursing, where I was, and I was leading the planning committee for that large conference. And I invited some colleagues from Brazil, and I extended one day to talk about um, different nursing education, research, and a lot of emphasis on APRN education. Um, my commitment to keep informing other faculty about APRN education regulation in practice started there, but we never stopped from there. Then COVID happened. So my presence of the importance of APRN in Brazil was through presence in online, attending multiple key conferences, talking about the role, the education, the regulations, and I also had a lot of colleagues that support this program. So as I mentioned, I am not APRN myself, so I did have a lot of support of colleagues. Then in 2022, we restarted the program face-to-face, and the idea was we extended that to colleagues from Brazil to come to the US and spend 1 week with us to learn more about APRN. Always focus in the whole dimension of what is APRN in terms of education, practice, regulations. So not too long for me to understand that only having faculty from STEAM universities, some faculty from who had interest in develop that kind of education, that was not enough for us to successfully progress towards regulating that in Brazil. So I started inviting key Brazilian stakeholders to also come to the US. So in addition of faculty, I had also administrators, I had provosts from universities, but I also included the council, the Federal Council of Nursing and the Ministry of Health from Brazil to join us. So strategically, I also support some colleagues in Brazil that were doing some kind of advanced work as a nurse, as RN, but I support them to apply for AANP international ambassador. We actually had 2 Brazilian colleagues who have received that. In 2023, 2024, we heavily expand our engagement with including different nursing organizations, other universities, and service. So strategically, we were looking at all the states in Brazil and making sure that we were inviting key people to come to the US to learn about that. I also became an external member of an advisory board of the Federal Council of Brazil, that they had created an advisory board for the advanced practice in Brazil. And again, we kept our presence in presentations of our US NP faculty attending conferences in Brazil and talking about their roles and what kind um, education and different aspects of nurse practitioners in the US. We were always making sure that we didn't want to create the advanced practice model that exists in the US, but we wanted that to serve as an example for them to departure and start the conversation. And the conversation really progressed really well. So we now start doing publications about what has been done in terms of pushing this education and this role in Brazil. And again, this last September, it was created the Brazilian Society of Advanced Practice Nursing. So they kept the model of AANP, and they created that society in Brazil this past September. Everything is strategically dialogue and communicate towards the development. So one thing that I want to emphasize is that this is really a global exchange partnership. So we do have the support of our American colleagues, university, hospital, clinic, community partners, faculty, students, alumni, and also we do have a large support from Brazil, including from representatives of the Minister of Health. So the curriculum that we present when they come to the United States, it varies a little bit from year to year, but we focus in providing some education about APRN education. So we give an overview of master programs, DNP. We also engage in students in presenting what they are doing in terms of their residence, their project, their experience as advanced practice nurse. But we also include some specialties, sometimes mental health, sometimes children, or so we varies a little bit the program depending on those that are coming. An important thing is we realized that was also important for those that are coming to the US to have a time for them to dialogue what has been done in Brazil, in what stage they are, and what is missing in terms of advocacy for this role to take off in Brazil. So we also have tours where they meet nurse practitioners in the community, in hospitals. One great piece is started with a collaboration from Dr. Capu that came to and talk to our guests about the AANP and all that AANP as organization, what they do in terms of advocacy, health policy, and promoting the role of nurse practitioners in the U.S. We also do have some social gathering. A lot of those that come in general, we have 10 to 20 colleagues during the week. A lot of them, they don't know each other because they come from various states. And a few times they also had the opportunity of attending a day of the College of Nursing Research Day. So as I mentioned, this is a partnership from various parts. And one of the things that we engaged was our office, international office, from the university level. So they formally welcome and tell the importance of them to be present in the US, not only for their learning, but also for our learning. Another thing is some universities and some colleagues tremendous value the formal creation of memorandum of agreement. And the reason is because for them to move forward their universities and creating new programs, developing new educational program, they have to demonstrate that they do have official partnerships with well-recognized American universities. So we formalize some of those partnerships during the week that we do have. We always create some visit sites where they have opportunity to meet and to engage and talk with the nurse practitioner. In fact, we had one colleague who is a faculty in a university where they are a little ahead of the curve towards offering that education. She came one time and then she came a second time to do a kind of internship in the clinic where we had introduced her. So she spent few days in the first time that she came visiting and dialogue. The second time she was actually shadowing the work of the nurse practitioner in the clinic. So that was an excellent. We also, although we foresee that the fact that they do have the public system and primary care is what they do beautiful, where they have great outcomes in terms of healthcare. And we believe that that is going to be the first place where nurse practitioners are going to be working, and that's going to be likely the first programs is going to be focusing in primary care. But we also show it to them the work of these nurses, advanced nurse practitioners that work in hospitals. As I mentioned, we do have a large presence of our students, and I think that is one excellent initiative that we had create because it's important for the student to understand their role in terms of global professional, but also to learn from us what we are doing and how they can contribute. But also for our guests, international guests that come to see how mature, how committed, and how amazing our students are in terms of the work that they are doing. I think that is an excellent way of exchange. So our students They talk about, as I mentioned before, about their residents, their clinical rotation, their projects. Sometimes we do have students that are in DC doing policy work. So we make sure that they talk to our guests in a way that their experiences serve as an example to see how committed these students are. We always involve our alumni because many of them are practicing, they are involved with um, VA hospitals, clinics, residents. So I think their presence is also very important. We do have one alumna that she created the first independent clinic in the state of Florida. So she came and she talked about all the challenge, but also all the great work that she's doing for the population. So this is the last group who attended, and you can see here again Dr. April Kapoor. She's one of the guests that we do have and talk about her work when she was in the AAPN. Well, she's still, but her work during the time that she was the president. So that is an excellent aspect. As I mentioned, the social gathering is beyond having a cake, correct? The cake is there, but it's also a great opportunity for us to learn about each other culture, not only between Brazilians and Americans, but also within the large Brazilian group, because they come from a very diverse places. So again, we have had 70 participants on this program, and we have had our presence almost in all the states, and that is something that we are proud of. We have had students who work on developing a questionnaire survey to evaluate how our program has influence. And they work also some US students and Brazilian students. So we were proud and also exchange their opportunity of talking about our impact. We also have had publication. We strategically publish in Portuguese, so we want to show the work that we are doing in Brazil. We have had some Brazilian nurses that were AANP ambassadors. Another important aspect is the fact that we have had our faculty and our alumni involved in several Brazilian sites. They have present in large conferences. They have present in schools of nursing. So in the last one was September, we had an amazing attendance where we had one primary care and one general nurse practitioners who went to Brazil with me, and their presentation were attended by 500 people in person and more than 20,000 virtual participants. So that was excellent. Another thing is I'm strategically looking at aspects to advocate for the need of advanced practice nurses in Brazil. And one way that I have found now is to talk about how nurse practitioners can influence and can impact the sustainable development goals. So we do have a lot of threatenings towards the sustainable development goals like climate crisis, world conflicts, the glooming global economic outlook, the lingering COVID-19 racism. So I'm strategically advocating that nurse practitioners or advanced nurses will really help to impact the population in Brazil, those challenges that they do have. So these are pictures that are from the reality in Brazil, and I highlight how nurse practitioners can impact that work. So here is just a picture of the development of the Brazilian APRN Society. Our program was recognized and we received an award from the Brazilian Federal Council. So we are proud of the work. Our work also helped to our faculty, our alum, to learn from other cultures and to appreciate differences. And I'm stopping here and say thank you. I'm open for any question you may have.
Thank you. Thank you so much. That was so just so much information, so much you've been doing just to really advance practice in Brazil, but also in your role now. So before I ask my questions, I was going to see if we had anyone from the audience. Megan?
Thanks for that presentation. I was wondering if you're meeting any resistance anywhere. Do you have any politicians that are resistant, any physicians, or where are you finding resistance on this?
The largest resistance comes from the medical workforce that is very to see themselves as the most important class as a professional. So we are trying to have the language there of the importance of working in teams. So, but definitely the the largest resistance comes from the medical class.